Today, we can generate the data from each patient regarding his daily life, regarding his demography, regarding his therapy, from each patient and from hundreds of thousands and millions of patients. With the research that is being done here and all the outstanding big data that can be accumulated from China, we will have a roadmap for digital therapy of people with type 2 diabetes.
Digital medicine is not only to care the patients, but also can change the whole system for the medical care.
If you look at the nature of modern diabetes, it's really a digital condition. So we can measure the condition of diabetes, we can assess the treatment successfulness, and also make decisions all based on the numbers.
I've seen many patients say, Professor Pozzilli, I now understood what diabetes is, thanks to all the opportunity to measure blood glucose control in a non-invasive way, and all through the technology of the smartphone that are now available everywhere in the world. So digital technology as an educational tool.
We are developing a remote transfer of information from the patient's home to the center where the team of diabetes educator, nurses, dietitians, and the endocrinologists receive the information and can give back feedback to the patient.
CODHy stands for controversies. So there's always another side of the controversy. I think patients want to see the doctor, and particularly on the first visit, they don't want to see some robot. Also, I don't believe that any aspect of digitalized medicine is going to help the doctor initiate the therapy. The physician needs to be there. He needs to talk to the patient. He needs to examine the patient. These are things that need to be done by humans. So I still think that you're going to have the physician working with the digitalization, computerized process to get the optimal care.
When I started these studies, we had to build models for pieces. Now it's all done on the computer and by the push button. And it takes months instead of decades.
The lecture by the Nobel laureate, Professor Ada, is fantastic. Very inspirational, can be used for future diabetes research and treatment.
I'm not a physician, but I would be very happy if I can help. And there was an idea to look at ribosomes as the cell components of people that have obesity, maybe employ something of it into before obesity. The idea came only today. And I would love, of course, I would love to be involved in such an important aspect of life.
We should share that knowledge with the younger scientists, let the younger scientists know how to do best science, how to do best medical service.
Science don't have a boundary. So if you can get inspiration from studies in other fields and actually making a breakthrough. We really need the young, talented, dedicated physicians to do this job, because we are too old to do that.
It's become one of the most popular meetings worldwide, whether it's CODHy China, CODHy US, CODHy South America, CODHy Europe, and there's always lively discussion.
We will continue our conference and we will continue to build the bridge between China and the rest of the world.
The fifth CODHy in China, I think, should be divided into two sections. One should be digital therapy only. And the other thing, as usual, we will discuss the new drug, the new development, the new finding.
CODHy has been and still is a modern, advanced and stimulating tool for educating doctors, health professionals working in diabetes, and should remain as such.